Since 2008 we organize these international meetings here in Bruges, and the reason why we organize this is to create awareness for everybody how important medical imaging is and how important breast cancer screening is. We also invite international rewarded speakers to talk to us about medical imaging and the new developments in medical imaging. So everybody, every patient, every potential harmless patient can learn from this, and also the doctors can learn from that to apply the most available and the best available technique in breast imaging. In breast imaging we have different imaging modalities at our disposal to make good images and to make good diagnosis. We have the classical RX mammography, we have the ultrasound, we have MR, we have PET-CT, and we have also liquid biopsy in the future or maybe nowadays. So these are different modalities we have available for diagnosing and also for screening in medical imaging. And that is a big range of different modalities where you can screen patients, where you can see results, where you can see how the patient is doing after therapy. So these are a lot of modalities that we can use in medical imaging, and there we have to choose the best available technique to do so. And there is a big evolution in new technologies in imaging. So we have very high resolution imaging modalities. We have very low dose mammography, very low dose scanners. So we have different techniques. We have also techniques in contrast enhancement, we have kinetics, we have diffusion imaging. So a lot of tools we have available to get the best diagnosis in medical imaging, to get the best diagnosis in breast imaging, to see the breast cancers as soon as possible in a very early stage, and to follow up the patients in later stages. So medical imaging is the key actor or the key thing in the hospital to diagnose, treat and follow up the patients with breast cancer. As we know, in the world, a lot of screening programs are organized for women, and it's very important that they do attend these screening programs, because we can see then the lesions or the tumors in a very early phase. And it's so important that all the women come to the screening test and to let them diagnose if they have a tumor or not. So if you follow a screening, you see that you have a reduced risk in developing a bigger tumor, and you have also a reduced risk in mortality. So come to the screening programs. We see the tumor in a very early phase if there is one, and so you can have good treatment and a very good survival rate. So as I heard before, there is a little gap of patients we don't reach in diagnosis or in screening. So we have to reduce that gap in screening the patients. That's the first step. So improve the screening and improve the amount of people that are screened today. On the other side, we do have new technologies, and based on the new technologies, we can depict the tumors earlier, we can follow up their therapy, we can see if the chemotherapy is useful and is effective, so we can do a very good follow-up, and I think in the near future we will reduce the death rate of patients with breast cancer, also because we have very new technologies and you have new medications, new chemotherapy, new radiation therapy that is very dedicated for every person. So I think we have to go to personalized medicine, personalized screening and personalized treatment, and I think in the medical community we have a lot of things available nowadays in imaging, in diagnosing, in therapy and in follow-up.